All right. So this is, I'm giving you guys the inside info as to my objective screening.
So traditionally, you would just be filling this out without just talking with the client.
So I'm listening to everything that you're saying, and sort of the way that I'm asking questions is giving me insight into this objective screen. But there are some questions that I am going to ask you specifically, like the next one.
Hi, I'm Kyle Kittleson with MedCircle, joined by double board certified adult and adolescent psychiatrist, Dr. Domenick Sportelli. Dr. Dom, how are you and your family hanging in there in the middle of the COVID-19 crisis?
Kyle, awesome to see you. We're doing okay. We're hanging in. I'm working at the hospital every day, and I'm seeing patients as well like this. So this is actually really appropriate. This is what we call telepsychiatry. Yeah. So hanging in. Thank you.
Well, I'm excited to learn more about what a med check actually is. As someone who saw their first psychiatrist at the age of 9, I don't think I've had an official med check. I've only had my doctors ask me, "Are you good?" And then that was kind of the end of it. So this will be a great education for me along with our viewers. Although you are not my personal psychiatrist, I am going to be very transparent here. I'm going to give you my actual dosages, my actual life, my actual feelings, in hopes that people can watch this and learn what goes into a med check and what a good med check actually looks like. So Dr. Dom, what is a med check?
All right. So a psychiatric med check specifically is once you already have a diagnosis, right? So this means that you've already had a full evaluation by a psychologist, a psychiatrist, or a behavioral health specialist. You've received a diagnosis and you've been placed on some sort of psychiatric medication. All right. So let's assume that already happened. Okay. So now, by APA guidelines, by medical guidelines, it's very, very important to follow with your psychiatrist or prescriber at least once every 3 months to make sure the medications are appropriate, that everything's going okay, that you're not having any side effects or problems. You might need laboratory studies, right? So it's a very, very important check-in with your doctor to make sure everything's going okay. Now, we want to spread that no longer than once every 3 months. Okay, and that's by, like I said, APA guidelines, AMA guidelines, and it's just really good practice. So you want to at least see someone once every 3 months if they're stable on a medicine. Okay, if someone is just starting a medicine, you might want to see them more frequently. You might have to see them once a month. You might have to see them 2 weeks after you start a medicine. So we're assuming right now that you're on a medicine, that you've been stable on a medicine for a little while, and you're coming in for a med check, that it's about that 3-month mark.
Okay, great.
And that's what a med check is.
Great. Well, I'm on some meds here, so why don't we check them out? I'll let you take it from the first question on how these med checks typically start.
So Kyle, when you come in for a med check, we're going to structure our assessment. Basically, I'm going to give you some doctor info here. I'm going to give you some behind the scenes stuff. When a doctor takes a note, we learned a long time ago in med school to do something called a SOAP note. That's SOAP. And that stands for subjective, objective, assessment, and plan. And every doctor's note, when you're talking to your doctor, this is what they're thinking, okay? So every doctor's note, every med check visit should be structured in a SOAP format: subjective, objective, assessment, plan. So the first thing that I'm going to do, and you could do that kind of, in various orders, but you want to make sure you get everything done. And the way that you should follow it is with your subjective. Start with your subjective. And subjective means, Kyle, that's you, right? How are you doing? It's not any formal testing. It's not any labs. It's let's talk about Kyle. So I like to open that up with just some very basic open-ended questions like, hey, Kyle, look, so it's been about 3 months. What's been going on? How you doing?
Got it. Okay, so it's been 3 months. How have I been doing? I have been doing well. In fact, I think I'm doing better than I would typically be doing. I have noticed that in my life, especially for the last, probably since 2010, I've noticed that when April, May, and June roll around, almost like clockwork, I plummet. It doesn't matter how consistent I am with my meds, how much I see it coming, I plummet. It's like seasonal depression, but for the spring or something, I don't know. And I haven't really felt that as we're filming this. It's April 13th, so I haven't really felt that yet, and I hope maybe I won't this year. That would be great. So that's been a really nice change in my life. So overall, I would say I'm doing good.
All right. So let's think about those past 3 months. try to think about some of the best times you've had and some of the most challenging times you've had over the past 3 months personally. What was some of the most challenging stuff you went through?
Well, the challenging stuff I went through is this challenging stuff we're going through.
Yeah.
We have MedCircle has adjusted our filming schedule to maintain the guidelines of COVID-19. I've had to move out of my own place, put all my stuff in storage. I'm in an Airbnb right now. That's stressful. And I have taken on the stress that all of my friends, all of my family are going through. I mean, my friends are either calling me and saying I don't have a job and I don't know when I'm going to get one, in the future, or my salary has been cut by 90% and I have a kid. People I care about and love are struggling. And I have taken that on probably more than I have in the past, probably for a lot of reasons. I'm interacting with people better, I think, really being empathic when I'm listening to people. So, but taking on that stress has been stressful for me.
All right. Understood. And, I want to validate that for you because that's real.
Yeah.
That's real. We're all going through that and it's absolutely real. What about thinking about some positives and some things that have been good for you in the past couple of months? Can you identify any?
Sure. I can identify a lot. I make it a habit to identify these things. So I have them. I am married to my work. My work is MedCircle. I think MedCircle is doing a lot of great things. So I'm very excited about that. We have really cool content that I'm getting to be a part of. We get to be really creative with our strategy moving forward that I'm lucky enough to be a part of. So I have found a lot of joy from doing the work that I've been doing. I would also say that these changes have also made me realize how lucky I am too. I still have a job right now. It's really great. I'm really thankful for that. I was complaining about having to move into an Airbnb, but at least I can move into an Airbnb, that's a good thing. So although I mentioned some of those things as stressors, on the flip side, I guess I do look at them as being things that I am thankful for.
So much insight, Kyle. Honestly, so much insight with your coping and your gratitude, right? And those are coping strategies. And those are things that make us feel better. So it sounds awesome. It sounds good. It's important when we talk, it's been a couple of months, to go through some biological stuff, right? I mean, and this is going to be important, especially because some of our biological actions really show what's going on psychologically, right? And what I mean by that is, my first question to you would be, how's your sleep?
When I get to sleep, it's great. Now, I'm the sleep king. I'll win the sleep Olympics, no question. I could sleep 15 hours a day. I really could. I could sleep 15 hours a day. I've gone to the doctor for my sleep issues because I've said there's no way this is healthy. I probably average 9 to 10 hours a day, however, but in the last 3 to 4 weeks, getting to sleep has become a little bit more difficult. As someone who was diagnosed with depression when they were 9 years old and multiple times since, I've always gotten I'm diagnosing you with depression and a little bit of anxiety. But I've never really felt the anxiety part. Anxiety isn't a mental health disorder that I feel strongly has affected me. I know it has, but when I compare it to depression wins hands down. So for the first time in my life, I'm starting to experience this anxiety, or at least become aware of it, and that's affected my sleep.
How long does it take you to fall asleep at night? You're saying you're having some difficulty. What are we talking? Are we talking 15, 20 minutes? Are we talking tossing and turning for hours?
Last night, I was tired. I took a melatonin, and it probably took me 40, 45 minutes. Where, to give you perspective, 3 months ago, less than a minute. I mean, I just put my head down and I fall asleep. It's just a decision I make.
Okay. All right, good. That's important stuff. What about things like appetite? You eating okay?
Oh, yeah. We filmed a virtual session with Grace Smith, who's a hypnotherapist, to fix my diet because I'm eating everything. I'm not eating good stuff that much, but I'm eating consistently. I'm putting on weight, and I have Crohn's disease, so for me, putting on weight is a win.
Because you're not sleeping so great, because you're increasing your caloric intake, how's your energy?
Poor.
Yeah.
Yeah. That's something I always have struggled with. B12 is a deficiency I always score low on when I get panels. Potassium and iron can also score low for me most of the time. And I notice the difference when
You're feeling tired. I mean, you're feeling tired during the day? Every day? Consistent?
Every day. Every day. For sure.
All right. What about like relationships, social stuff? Things are going okay? Any stressors? Family, friends, loved ones, relationships, romantic stuff?
Man, no stressors. With my family being in Arizona and I'm out here in California, there is some stressors going on right now because I feel farther away from them, even though I always live away from them. Just the idea that I can't go see them and they can't come see me is stressing me out a little bit. But no, my social life is good. My romantic life is fine. I'm not actively dating. I don't really want to actively date anyway. And I have a great relationship with my family. So I would say that's solid.
All right. What about therapy? What about psychotherapy? Now, we only meet once every 3 months, right, for your med checks like we're doing now. What about psychotherapy? Are you seeing a therapist currently?
I see a therapist, but I haven't seen the therapist in, 6 weeks, 8 weeks possibly. Well, it started because we were in the midst of a move and I thought I was going to have to find a new therapist when I moved. And then we didn't end up moving because of Corona. And now I just decided not to see a therapist during Corona. I guess I could ask if they do virtual, but I just haven't.
Got it. What kind of therapy was it?
I don't even know. A lot. I mean, it was talk therapy. It was talk therapy. And it was probably a combination of CBT and maybe some DBT as well. My therapist, I never really asked her like, hey, is this what we're doing? But because I work at MedCircle, I have some understanding of how therapy works. So that's kind of the vibe. But really her role that I've enjoyed is that she just will push me for an answer. Because sometimes in therapy, I want to not be fully honest.
Good. She holds you accountable. And it's helpful for you. You're obviously going back for a reason. Something is therapeutic and beneficial about it.
Totally. Absolutely. Yeah. Oh, I love therapy. Yeah.
All right, good. So that would be what we call the subjective part of our interview, right? And as you can see, it was really about you and your relationships and your family and your friends and how you're feeling. A little bit of biology there. And then what we'll do is we're going to do something called a review of systems. All right. Now, this is more medical. This is when we start getting into medical. Now that we have the subjective stuff out of the way, I'm going to start asking you more objective questions. Okay. So I'm going to ask you, so Kyle, since the last time I saw you, 3 months, it's been about 3 months, any medical things pop up? Have you been sick? Have there been any, infections, coughs, colds, flus, any injuries, any trips to the hospital for any reason, any trips to your medical doctor for any reason?
No.
Nothing. Wow, you're making this easy on me.
Yeah, I'm trying to rack my brain. I mean, I have Crohn's disease. It is sometimes a daily struggle, sometimes a weekly struggle, but I most of my symptoms are in remission. I've got that under control. I would say it's the best it's ever been. So awesome. I can't even complain about my Crohn's.
Awesome. Okay. All right, good. So thinking about things day to day from a physical standpoint, you're not noticing any physical symptoms. And it really just goes from head to toe. And like literally any headaches, dizziness, blurred vision, any sort of
weight gain.
Weight gain.
I'm going to be 34 in a couple days. And this is the first time in my life that I've ever been able to gain weight. And look, I know people are going to hear that and go, sounds lucky, but really Crohn's just depletes you. You can't put on weight. And so I'm thrilled that I can put on some weight.
All right, good. All right, so you're happy about it. How much weight are we talking?
Oh my gosh, I probably put on like 10 pounds.
Okay.
Which is a lot for me. I know that doesn't sound like very much, but that's substantial for me for sure.
Over how long a time period?
I'd say over maybe 8 to 10 months.
All right. And you're not necessarily trying to gain weight?
No, I'm not.
Okay. All right. So physically, you're doing pretty good. When was your last physical exam?
Oh, God, years ago.
Years?
Yeah.
You get an annual physical? All right. So now you get a ding from me. So now it's like the medical thing. You're gonna get a little ding. What about your gastroenterologist or your rheumatologist for your?
Well, that's true. I mean, like I had a colonoscopy earlier this year,
Okay.
but I haven't gone to a primary care physician and gotten a physical in probably 2 years.
Okay. All right. Sounds good. But I definitely want you following with your primary care doc as well. That's going to be a little bit of an important thing. So now what I want to do, Kyle, is I want to do something objective as well. And I want to get a number. Now, I'm writing down everything you're telling me about your emotions and how you're feeling, and things are generally really good for you. Medically, you're doing pretty good. I'm listening very closely to your mood and all those things. But I do want to get a number. All right. This way I can jot down a number and compare that next time. And the way that I'm going to get a number is by giving you something called the Montgomery-Åsberg Depression Rating Scale. All right. So you're going to bear with me. I'm just going to go through some questions with you. You are going to answer either from 0 to 6. Now, 6 being most extreme, and I'll help you with these as we go, and 0 being none, no symptoms. Okay. So just from what I'm seeing here, and this is actually a clinical assessment. It's something that I see and I kind of jot down as I listen to you. So my first question to myself is, are you expressing apparent sadness to me? Do I see sadness in you, right? And from a 0 to 6 is 0 is no sadness, and 6 is looks miserable all the time, extremely despondent, all right? So this conversation so far, I see 0 sadness.
Okay.
I've seen 0 sadness. You're going to get a 0 from me on that one. Question number 2 is reported sadness. Did you tell me anything about being really down in the dumps? Did you say anything to me? Right? So not only am I observing you, but did you say anything? And you really didn't. As a matter of fact, you said that around this time of year, you get pretty down, but you're feeling pretty good. So in that case, I'm going to give you occasional sadness, but keeping with circumstances, and that's a 0. All right. So I'm giving you guys the inside info as to my objective screening.
So traditionally, you would just be filling this out without just talking with the client.
So I'm listening to everything that you're saying, and sort of the way that I'm asking questions is giving me insight into this objective screen. But there are some questions that I am going to ask you specifically, like the next one.
Got it.
So the next one, number 3, is, Kyle, do you feel tense? Do you have this feeling of inner tension? And just to make it a little clearer for you, 0 would be totally placid, like totally relaxed, and 6 would be unrelenting dread, right? So where are you on that scale from a 0 to 6? Tension.
I can't imagine that anyone's a 0. Goodness. I would say at my worst, I'm a 3, but I'm normally a 1. I'm a 1 guy. Okay, so between 1 and 2 is occasional feelings of edginess and ill-defined discomfort. Yeah. Occasional feelings, all right? I'm going to give you a 2 on that one. Now, you mentioned to me number 4 is sleep, all right? So now you told me that, and I asked you specific questions when I was inquiring to get a number here. So 0 would be sleeps as usual, and 6 would be less than 2 or 3 hours of total sleep per night. So what you're telling me is probably around a 3 or 4, which is slight difficulty dropping off to sleep at night, or fitful sleep, or sleep reduced or broken by at least 2 hours. So I'm going to give you like a 2 or 3 on that one. Yeah, that sounds perfect. All right. And then I asked you about appetite. Remember about the appetite question? And that was an objective question. Normal appetite or needs persuasion to eat. You have a normal or increased appetite, so you get a 0 for that. All right. Giving you all my little secrets here, guys. I love this. I love giving you all my little secrets. So the one thing I did not ask you about, and that's why it's really good to have an assessment questionnaire in front of us, is it reminds us sometimes. So number 6 is concentration difficulties. So are you having any difficulties in collecting your thoughts? Do you feel that you have an incapacitating lack of concentration? Anything that you're like, oh my God, my memory, I'm just not doing so well with concentration. And again, to put it in perspective, 0 is no difficulties, and 6 is unable to even converse without difficulty. Where do you stand there? Where are you at with concentration? Well, it's not a 6, okay, but it's not a 0. So I would probably say it's a 2, because I have noticed that I don't go outside anymore. We're in the middle of lockdown. So I'm constantly looking at my phone, which keeps my brain really occupied. The moment I can't occupy my brain, I start to lose focus and I feel disheveled. I don't know if that made sense. And, so I would say a 2.
So and again, I probably wouldn't say this to you, but this is for the education of our viewers. A 2 is occasional difficulties in collecting one's thoughts. Sound about right to you?
That sounds right. So, and will you go over the purpose of that question?
Absolutely. Okay. Absolutely. Well, I can tell you right now.
Yeah.
Because the Montgomery-Åsberg Depression Scale is a clinician-administered scale to gauge your level of clinical depression. And if you look at the Diagnostic Statistical Manual of Depression, concentration attention is one of the issues. Right? So we're really checking that because sometimes depression can masquerade as neurologic stuff, right? Just really can't get your thoughts together. You just feel kind of loopy. You don't feel right. So it's one question to really make sure. Not to mention, as a review of symptoms, if you're suddenly telling me, Doc, my memory's going out of whack, that's going to raise some red flags into what I'm thinking about medication side effects, about potential referrals to a neurologist or something like that. So it's an all-around very, very important question from a psychiatric interview on a med check.
Yeah, that makes more sense. And I was on a med for a while. I forget what it was, but I finally went to my psychiatrist and said, Doc, I really think my brain is clouded from this med. Yep. I don't feel depressed, but I'm walking through the day like I'm having to look through clouds and really try to focus. It's work. And when I went off of it, those symptoms went away. So I understand that. Perfect.
So the next question is, and I didn't ask you this specifically, and again, this is a great prompt for me for this scale, is a word called lassitude. Now, lassitude it represents a difficulty getting started, right, in anything. It's just like this slowness of initiating and performing everyday activities. So again, from a scale from 0 to 6, 0 being hardly any difficulty in getting started, no sluggishness at all, and 6 is like, I can't do anything without help. All right about in the middle is difficulty starting simple routines, but are carried out with effort. Where are you on that scale?
2 or 3,
okay.
I think.
Okay, so difficulty starting things, but once they get rolling, you're pretty good.
That's right. I mean, even today, going into work, I go, man, I have so much to do. But then once I started, I was like, all right, let's get it popping. Let's go.
All right, beautiful. Now, the next question is actually really interesting because when people are depressed, they tend to lose the ability to feel. They can actually feel kind of numb. So the question I'm going to ask you now is your interest in your surroundings and other people and social things, is it still there? Do you still have interest in things?
Yes. I know exactly what you're talking about. I know exactly that symptom. That is the hallmark symptom of my depression, and I do not have that right now.
Got it. The fancy word for that is anhedonia. And again, and just for our viewers out there, I want them to understand, and some people score a 6 on this, and 6 would be the experience of being emotionally paralyzed, inability to feel anger, grief, or pleasure, or even a painful failure to feel for close relatives and friends. So you can't even feel. It actually hurts that you can't feel, and it bothers you that you can't feel.
I get it. When I was my father. My father's very supportive of me and my struggles with depression. And I tried to explain it to him one time because he's never been diagnosed with depression. He's not that guy. And I said, Dad, it would be like somebody showed up to my house and I said, Kyle, you won the lottery. Here's $100 million. I fundamentally would understand that was good for me, possibly, or at least this would mean that I would have a lot of money to do a lot of stuff with. But I wouldn't feel any of the enjoyment, surprise, shock. I would look at him and I go, well, I guess this is good, but get out of my house, because I got to go to bed. So I get that. So
perfect explanation. Perfect explanation. So the next question is pessimistic thoughts. How you doing with that? And again, 0 is no pessimistic thoughts, and 6 would be almost delusional thoughts of ruin, remorse, unredeemable sin, self-accusations, unshakable pessimism. That's 6. 0 is no pessimistic thoughts. Where are you at?
Sin. It sounds like serious.
It gets bad. I mean, it gets bad.
Yes. I'm a 3 to 4 as of recently. I'm kind of on the higher end. I've been having to check my thoughts. I even texted a friend something the other day, and he goes, "What is that?" And I go, "Honestly, it's just a cognitive distortion I have." And so I have been higher on that in recent times. Yeah.
Okay. And again, for the viewers and for you, 4 would be about persistent self-accusations, definite but still rational ideas of guilt, increasingly pessimistic about the future. You see, we're still kind of rational, but you're still beating yourself up about it. It hasn't taken it to that level where you're like, Kyle, you're not, what are you talking about? Like, none of this is true. Like, it's still somewhat rational, but you are beating yourself up about it. So we're going to give you a 4 on that one. All right. And the final question is, in the past few months or even now, have you had suicidal thoughts?
No, I have not.
All right. So we can give you a 0 on that. And 6, of course, would be explicit plans for suicide, right? That's extreme. 0 is none. You can have feelings of potential. You could say to me, you know, sometimes I feel like I'm better off dead, and I have some suicidal thoughts, but I don't have a plan or intent. That's about a 4. All right. I mean, this still needs to be taken seriously. And out of all of the questions I asked you there in that med check, that one is so important because that's life and death, right? And if you tell me anything on that scale, anything other than a 0, it's going to be worth really, really digging into and making sure you're safe. Okay. Now, I know that took a little while because I did a lot of explaining through it and we chatted through it. That was only 10 questions, right? But normally in a med check, you get through them quicker because I would have made it a little bit more conversational and probably wouldn't really let you know too much about how I'm marking things, right?
Right.
Educational purposes. So, but you did get a number. All right. I'm going to share your number. You got 2, 4, 6, 8, 7, 8, 9, 10. You scored a 10. Okay. So what I'm going to do here on my charting is say that on your MADRS, Montgomery Asperger Depression Scale, you got a 10. All right. So now I have something to compare to, and I keep this in my chart. And for the record, 10 is not a bad score. All right. It's not a bad score. It doesn't really show significant clinical severe depression. If you scored higher, it might prompt me to think things about our med check, like, let's think about those meds you're on because they might not be working. Let's think about some more intense psychotherapeutic intervention, right? So this test is important for a lot of reasons, right? It's going to lead me to the assessment and plan. This is still part of the assessment, but this is going to lead me to a very specific plan moving forward, right? It gives me some hard data.
Yeah.
Right? So that's the Montgomery Asperger Depression Rating Scale. That's going to go on my chart with your score. As you know, we did our subjective, we did our objective. Now what we're going to do is talk about your medications, okay? So right now, I understand that you're on a few medicines. If I'd have seen you before, I'd have them all on my chart. But why don't you, if you're comfortable and you're willing to divulge that, tell us what you're taking right now.
So I take a Zyrtec every night. I take a medication called Colestipol. I use it for Crohn's. I take about 3 to 7 milligrams of that a day, I think. I think each pill is a milligram. I could be wrong on that, but I'm pretty sure. I take finasteride, which I believe is the generic form of Propecia. And I take paroxetine, which is, I think, Paxil, right? So I take a 20 milligram tablet at night for the paroxetine, and the Propecia, the finasteride, I do a 1 milligram tablet in the morning.
Got it. Perfect. Is the Paxil the controlled release, the CR, or is it just regular Paxil?
Don't know.
And that's okay. That's okay. We would figure that out, though. If this was a real deal, I would know that because I'd be prescribing it for you.
It's not in a capsule.
Got it.
It's like a pill. It's just a pill.
Okay, so now that we're discussing your medications, what I like to do with every single person that is on a medication is psychopharmacology educate, right? So it's incredibly important that you know what every medicine that you're on is doing and how it works, even if it's just a basic understanding. I want you to be educated that way, and any doctor should, all right? So let's talk about your Paxil. Now, Paxil, you've been on it for how long now?
Oh my gosh, 2.5 or 3 years.
Okay. All right. So Paxil is an SSRI, selective serotonin reuptake inhibitor. You know that increases serotonin in the synapse. It helps with mood. It helps with anxiety. It helps with obsessive compulsive disorder. It helps with social anxiety. You're kind of at a medium dose at 20 milligrams. You're sort of right down the middle. People can go up to 60, 70, milligrams per day. Starting dose is about 5 or 10 milligrams. So you're right down the middle. Specifically with the Paxil, and you may not know this, but you've been on it for a long time, and it's harder to notice these things when you've been on it for a long time, but is there anything that you can identify that the Paxil is doing to you in a negative way?
The only side effect I could really think of that's really detrimental, I guess, would be it makes me drowsy, but I take it at night. And so, I use it to go to bed. No major side effect. I mean, there are little side effects here and there, but nothing where I'm like, oh my gosh, I got to call my doctor. And I've been on meds before where I thought I can't be on this. And I've just called the doctor and we've adjusted.
All right, perfect. All right. And here's the truth is sometimes Paxil can make people tired. Paxil, what we know as doctors is that it has a little bit of an antihistaminic component to it. And I know that might be some medical jargon, but it can make you a little bit drowsy and a little bit tired. And you're doing exactly what we would recommend. We would say, you know what, if it makes you drowsy, just take it at night. If that drowsiness continues during the day, then definitely let me know. And just off the top of my head, Paxil is a notorious weight gainer. However, you've been on it for some years, right? With not excessive weight gain. You're only telling me you gained weight in the past couple of months.
Right.
Right? But Paxil is a notorious weight gainer. And Paxil has a very short half-life, meaning if you miss a dose, people tend to feel a little uncomfortable. Has that ever happened to you? If you miss a dose?
Doses, yes. I wish I was the guy who was just on it, but I'm not. I miss doses. It happens. I don't notice a difference.
Okay, and that's great news, actually. So that's really, really good news. But it's important for you to know some of these potential side effects. This way you can identify them, and you don't think that you're crazy if that happens. Like, I missed a dose today, and I feel a little weird. I feel dizzy. I feel like I'm coming down with something. I want you to know that, and I want you to be educated about it. All right? So that's your Paxil, and you're at a medium dose, and things are looking pretty good. Now, Propecia or finasteride, do you know how that works? Because I want to explain it to you. Everything that you're on, I want you to know what it does and how it works. So even Propecia is what's called, it blocks an enzyme to prevent testosterone from being converted to dihydrotestosterone, right? So that's all that it does. It prevents that enzyme from turning testosterone to dihydrotestosterone. And dihydrotestosterone is bad because it makes our hair fall out.
Oh, okay. There you go.
Okay. So DHT or dihydrotestosterone is the bad product of, I don't want to say bad, but it's what you're trying to avoid when you take Propecia. So that's how it works. And is that what you're taking it for? Are you taking it for thinning hair?
Yep. Yeah. And hello, it works great.
It doesn't look like you need it. Either it's working great or you don't need it. Either one.
It's still working great. I'll show you some before pictures. But yeah, and I actually, at one point, we're taking all my meds at night because it was just easier that way. And then my pharmacist kept putting on the bottle to start my Propecia in the morning. So I moved it to the morning. Does Propecia ever act as an upper, or would it keep people from going to sleep?
No, not that I'm too familiar with. I don't prescribe it that often. Right. I know the basic mechanisms, but I don't think so. But listen, if it keeps you up, take it during the day. It's that simple. The other, Zyrtec, allergies, right? What do you take, a 5 or 10 milligram? Do you know? Okay, whatever. But you don't know that you're having any problems or side effects from it. Nothing like that.
I don't take it. My skin gets itchy, so I take it.
And then you take the medication, Clostopol.
Yep.
Right? And now this is an important one because part of a med check, this is where the med checks are important. Your doctor needs to know everything you're on because there are interactions that you really want to avoid, okay? So that particular medicine is what's called a bile acid sequestrant, right? So what that does is it makes your bile acid go out when you go to the bathroom, right? And what that does is it makes your gallbladder make more bile. And guess how we make bile? We use cholesterol in our blood. So you can use it as a reduction in cholesterol or a reducer of bile acid, which helps with Crohn's, all right? But here's the important thing with that medicine, and I hope somebody told you this. And if they didn't, and you're hearing it for the first time, it's actually really important. Because it affects your bile acid, it can affect the metabolism of your other medicines. All right. So what you want to do is take your other medicines either an hour before that medicine or 4 hours after.
Oh, man. All right. See, I haven't been doing that. I just take it whenever.
Yeah, no. So that's very, very important. And that's exactly, so this is a perfect example of why going over every single medicine is important, because what could potentially happen, Kyle, is if you take all those medicines together, that medication can reduce the efficacy of your Propecia and your Paxil and your Zyrtec.
Gee. Okay,
Yeah.
so electable 4 hours after I take the other meds?
You want to take your other medicines either an hour before you take that medicine or 4 hours after you take that medicine.
Got it. Okay.
Got it? All
Yep.
right, cool. All right, so that's important. So we went over your meds. You're not having any problems with the meds. You know how to take them. That's beautiful. So now we're going to go into our assessment. All right, so the assessment is basically everything that I summed up in my mind about our meeting today. All right, it sounds like, and this is sort of in my head, I might not tell you this, I might tell you this, but in my head, it sounds like you're doing really well, right? So aside from a few complaints that you had subjectively, sleep, which makes sense to me because your circadian rhythms are probably off. There's a lot of stress due to COVID. There are a lot of things going on in the world right now, transitional type things that will absolutely throw off sleep, right? So it's not something that's raising a huge red flag for me because you're not telling me that, Doc, I'm only getting 1 hour of sleep at night. My concentration is shot. I feel terrible during the day. I'm tossing and turning. I'm anxious at night. If I heard that, I might think, okay, Kyle, we need to address this some way. Let's see how this progresses over the course of the next few months. And if it continues to be a problem, I would tell you to call me. I'd say, listen, I heard the fact that you had some sleep issues. I don't want to introduce another medicine to that. I want you to pay attention to your sleep hygiene, right? Avoid caffeine. I'd give you all those sleep hygiene tips and call me in a few weeks if it continues, and then we can readdress it. All right. So I want to address everything you told me. And that was pretty much the only negative that you told me.
Yeah.
Right, about sleep. Now, again, we went through the objective questionnaire. In my mind, you did pretty good on that objective questionnaire. I didn't really hear anything bad. So that means that your major depressive disorder is under control. So that also tells me that I'm not in a position right now that I'm going to recommend any augmentation of your medication. Mm-hmm. Now, even though I told you that your Paxil can go up in dose where it certainly could, I'm not going to recommend that for you because you don't need it. Right? So as far as our plan now, right, this is where we wrap things up. The plan is going to be make sure that you remember what I told you about those medications and how to take them appropriately. Make sure to call me in a few weeks if your sleep doesn't improve. I want you to go over some of the sleep hygiene stuff that I would give you, right? Definitely maybe consider calling your therapist and getting kind of back into the swing of things, especially now. Yep. Because that can sort of like progress and snowball where you're not going to talk to your therapist for another few months, right? So I would definitely recommend that. And I would say, unless anything else comes up, you're good. I'm going to write you a prescription for your medications, and I'm going to see you in 3 months. So that was a psychiatric med check. Now, in a perfect world, it takes about 30 minutes, right? So we kind of, I explained a lot. We really sort of broke it down. So maybe it took a little longer. I don't even know how much time we're at now, but that is a med check, and that's the purpose of a med check.
Now, I've asked this question, and I've had a lot of people ask me, so I'm going to ask you now. I have been told by many psychiatrists that I am unlikely ever to be in a position where I could go off my antidepressant and not relapse. And when I say relapse, I mean I'm, on the side of the road kicking and screaming in my car in tears because I cannot function due to the depression, or I will not leave my house for months. I mean, I won't leave the bed. They go, I've been told that basically I will always have to take an antidepressant. I don't like that. I don't like the idea of it. I understand it works. I understand I should be thankful for that. But if I don't have to take a med, I don't like to take it. What are your thoughts on that?
Yeah. Awesome question. Awesome question. And that prompted me to something incredibly important, is that before I end every session, and I didn't do it with you, I can't believe I didn't do it, I always ask a patient or client, I say, is there anything that you have, any questions that you have about your psychiatric regimen, about your medications, about anything? Or is there anything that you feel is important that I did not ask you? Anything important that you feel that I didn't ask you. And that's where you would have probably chimed in and said, Doc, I've been on Paxil for a while, and what's the deal? Do I have to be on this forever? Now, if I did your initial assessment, I would have done a thorough psychiatric history, right? So I'd be speaking from a place of a little bit more knowledge about your history with depression, how many episodes you've had, how severe it was, were you ever suicidal, things like that. Now, of course, psychiatrists try to make things easy with algorithms, meaning we do kind of have a little bit of a formula when it comes to this. If someone has had one episode of depression, one major depressive episode in their life that devastated them, but it was one major episode, no suicidality, just clinical depression, you do a trial of an antidepressant for approximately 6 to 9 months before thinking about maybe a trial off it, okay? If someone has had 2 to 3 bouts of a major depressive episode in their life, they're probably going to be on it for a few years before you decide to wean off. If someone has had 4 or more cycles of severe major depression in their life, you're probably going to want to stay on that medicine. Now, look, and also one more thing to add, if you've ever been suicidal, right, now we're talking life and death, it really changes the game, because we want to avoid that from ever happening again. Now, with a grain of salt, right, that's sort of the algorithm, right? However, everyone is different. And if you said to me, Doc, I want to get off my Paxil, my first question is going to be, all right, this is a very valid discussion, but why?
Yeah, right.
Okay, why? So you could tell me, because I have this horrible side effect. And then we'll talk about that. And maybe Paxil's not the right medicine for you, or maybe the risk benefit doesn't add up. Maybe you were never suicidal. Maybe you only had one episode of depression in your life. Maybe, okay, Kyle, let's do it. And the proper way to do that would be to taper it very slowly and see how you do, right? I'd say, okay, let's cut back by 10 milligrams. And as a matter of fact, Kyle, I'd love to see you back in the office in a month, or maybe even in 2 weeks. And let's see how you're feeling. Or call the office in a few weeks and check in. Let's make sure everything's going okay, right? But on the other end of the spectrum, if you've been someone that has severe major depressive episodes, you've ended up in the hospital, you lost jobs, you've been suicidal, then I'd really say, why do you want to come off? What's going on? And if it's just because I don't want to take too many medicines, I'd say, well, we're just going to do a risk-benefit analysis here, and I'd probably encourage you to stay on.
Yeah. That's a good answer. And I'm glad people can hear that, because it's just the reality of where we're at right now. And for me, it's just something that I've more or less accepted. I brought it up because it bothers me, but I still have accepted the fact that that's probably going to be my life from here on out. And I'd much rather take a med than be in the bouts of a major depression. So, I'll take the med any day of the week.
Yeah, and Kyle, too, I want to emphasize, and I think it's important for the viewers to hear, that every case is completely unique. And you know what? If you were doing amazing with psychotherapy, and if you've grown as a person insightfully over the years, and you're just doing so well, and you haven't had any relapses on the medicine, and you really wanted to cut back, and I didn't see a severe risk, I would entertain that, because I'm not the guy that believes that people need to be on medicines forever either.
Right.
So you really have to listen to the nuances in each circumstance before you make that decision.
Well, I'm going to take your advice right now. Dr. Dom, what did I not ask you about the med check that I should have asked you?
So I think we're pretty thorough, right? So we did our SOAP note. We did our subjective, right? The subjective was, Kyle, how you doing? Good, bad, challenges, life transitions, relationships, social. Our objective was all of those medical questions I asked you, plus the Montgomery-Åsberg Depression Scale. Our assessment was summing it all up. And the plan was exactly what we told you. So I think we got it. I think we nailed it.
Dr. Dom, how should viewers take this information that you provided them today and use it to have a better med check in the future, or just overall improve their mental health care?
Yeah, so, as we always say, and I think this is why MedCircle is amazing, is that an educated patient is an empowered patient, right? And you're empowered. You are empowered. So what we did today, it might not be perfect, right? But I think it was a pretty thorough, solid med check. And honestly, that's how they should be done. So if you're going to see your doc and you're like, what the heck just happened here? He didn't ask any of those questions. It was like a 5-minute interview. Then you know what? You might want to find another doc. Let's hold the doctors accountable as well by showing how it should be done. All right. So it's about patient empowerment, right? So if you're noticing that your doctor is not doing these things, you could certainly ask them.
Excellent. I love that. The empowered patient. Dr. Dom, appreciate your insight and knowledge. I'm Kyle Kittleson. Remember, whatever you're going through, you got this.